Hello everyone, welcome back to my channel. So today we are going to start GIT medicine lecture, and in this lecture we are going to study about GIT disorders, and we will start from the GERD. So we will start from the basic information like what presenting complaints can a person present to a doctor during GIT disorders. First is like dysphagia. Dysphagia is a swallowing difficulty, vomiting, dyspepsia, heartburn, GIT bleeding, and GIT bleeding is a very most important, like it can be upper GIT bleeding or lower GIT bleeding. Next is abdominal pain, regurgitation. Regurgitation is a disorders of moving of food in the opposite direction like stomach to esophagus. Next is constipation, indigestion, weight loss, malabsorption, ophthalmos ulcers, peritonitis, candidiasis, and cancer. Cancer can be of oral, stomach, small intestine, or large intestine. Next is investigation. What investigation can we do in diagnosing of GIT disorders? Like first we'll do plain X-ray. Can we do endoscopy? Endoscopy can be investigation of choice of various GIT disorders like GERD. Endoscopy is various types like upper GIT endoscopy, endoscopy ultrasound, capsule endoscopy, wireless endoscopy, double balloon endoscopy. We can do CT or MRI. CT can be contrast enhancing like CECT, contrast enhancing CT scan. Sigmoidoscopy, colonoscopy, MRCP, and ERCP. Next, to rule out of cancer disorders, we will do histology examination. Like for infection to rule out, we can do cultural investigation, serology, or breath test. Next, we can do test of absorption, radioscopy testing, gut hormone testing like amylase. Now we will start the various disorder of GIT, and we will divide the GIT in various parts, and we will start from esophagus. Disorders of esophagus can be of inflammation infection, which is also known as esophagitis, and can be due to GERD, infection, or others. Next is mobility disorders, in which the food cannot be able to pass to the lower abdomen or lower stomach and is stuck here, like acalsiacardia, DES, which is diffuse esophageal spasm, nutcracker esophagus, and diverticulum. Next is hiatus hernia, Mallory-Weiss syndrome, esophageal webs, esophageal perforation, like when we drink bleach, acid, or during endoscopy. Pre-malignant condition, malignant condition.